Hello, Dr. Vicki Peterson here. This is my second in a series of looking at your body, yourself, and seeing if you have any nutritional deficiencies. The first in the series was on your fingernails, looking at your nails and having them give you an idea of what sort of health issues as far as nutritional status or deficiencies you might be having to look at. And today we're going to be talking about your skin, including your lips and your tongue. And it's interesting how we'll go over a long list of different things that can occur, but they have some very common threads amongst the long list, so that we're going to go over that. But I think one of the biggest issues to address is the fact that when it comes to skin and traditional medicine in this country, I mean, if you see a dermatologist and you point at something that has a rash or a redness, they're going to want to put something on that, a steroid cream, have you take a medication to address that issue, which I have a problem with because it's not root cause medicine. It's not getting to the underlying root cause of what your body is trying to communicate to you when it gives you this rash. So when you have any sort of skin condition, first of all, it's important to realize that the skin reflects the health of the gut, the colon. So you want to look there. And much of what we're going to be talking about today is how various skin issues are reflecting a deficiency of some sort, whether it's B vitamins or minerals like zinc, or antioxidants like vitamin A, essential fatty acids, also very, very important fats for the skin, and these all play a big role in the health of the gut as well. So there definitely is a very strong link between skin and gut, and if you treat it there, if you really get to that root cause of what's really malfunctioning, not only will your whole health improve, but your skin will improve as well. And we've always said it, if you look at somebody's hair or nails or skin, you can kind of get an idea of how healthy they are. And it's true, it is a mirror to health. So we're going to take a little journey looking at your skin and see what we come up with. I have some notes here, so I'm going to look down a little bit as I refer to them. So what about dry, kind of scaly skin? Whether you see this on yourself or you see this on people it's a very common thing that we see, and also something called it's called follicular hyperkeratosis. Forget that. But people call it chicken skin often because it's often on the back of the arms, and it looks like chicken skin. If you look at chicken skin raw up close, it's got these little bumps, and that's what follicular hyperkeratosis looks like. So that is very, very common with essential fatty acid deficiencies. We're going to get to that in a little bit. And zinc and vitamin D are very common with that as well. And then when what about eczema or dry kind of itchy? Well, it's dry, it's itchy, the skin is very pale, it doesn't have any shine to it, it's a very dull appearance, and that eczema type rash is also associated with zinc. So I want to first go through the common skin conditions that are associated with zinc deficiencies. And zinc is a very important mineral that many people are deficient in and need to augment in their diet. The way we do augment it is with whole grains, pumpkin seeds, sesame seeds. They're particularly high in zinc. But if you're a pregnant woman or a lactating woman or a vegetarian or vegan, you have to work a little bit harder and probably need more zinc than the average person, because especially with vegetarians, well, the women need more as well. But the reason vegetarians need more is because they're eating foods like beans and vegetables and legumes that are high in what's called phytates, and they compete with zinc, so they kind of get in the way of your body absorbing zinc, so you need to put more into your system. Pregnant women obviously are building a baby body from scratch, so they need more of various things, zinc included. And then of course with lactation, you're providing that extra nutrition to the baby, so you need some extra of various things, zinc included. Okay, so moving on. There's also called something, it's called angular stomatitis or chelosis, but you see it often in children. They get that, the corner of the mouth, right where the top and bottom lips meet, it's kind of open, like an open sore. It can be red or actually cracked. So that's what angular stomatitis is, and that's also associated with the zinc deficiency and B vitamins as well. We're going to come to the B vitamins in a moment. Geographic tongue, so you stick out your tongue just like when you're a kid or even an adult and you go see the doctor and they say ah. They're not just looking at the back of your throat to look at your tonsils, but they're also looking at the tongue itself to see. Now a geographic tongue looks a little bit like a geography lesson as far as land masses and the water, meaning that it's not just a smooth, homogeneous look to your nice pink, healthy tongue. I hope that looked good. But instead, it's kind of blotchy and splotchy, looking like, they call it geographic because it's like you're looking at, you know, North America, South America, and it's all looking a little bit distinct from each other instead of nice and smooth. Diminished taste is a very important one, and that is firmly in the camp of zinc deficiency. So if you feel like your taste buds are not working as well as they should, that's definitely a zinc deficiency, can be a major cause. All right, let's go on to vitamin A. So vitamin A is one of our antioxidants along with E and C and beta-carotene and glutathione and lipoic acid. So these are all antioxidants, and they really work better as a team. So even if I mention something here right now that is a skin issue that you have, you really want to know to take your antioxidants together as a group because they work synergistically with each other. So you don't just want to take a whole bunch of A because you'll tend to throw off the balance of the other antioxidants. Now A, as you know, probably from school as a kid, you learned that carrots had a lot of vitamin A, so those orange vegetables and fruits are higher in vitamin A. Sweet potatoes actually amongst the highest, followed by carrots, squash, and also dark green leafy vegetables. So they're not orange, but they just are loaded with everything, including vitamin A. So the skin conditions associated with not enough vitamin A is that dry scaly skin, dermatitis it's often called, the chicken skin, as we mentioned earlier. Acne is definitely associated with vitamin A, along with zinc, as we mentioned earlier, and gingivitis. So if you go to the dentist or you just look at you don't have to go to the dentist, you just look at your gums, and if they bleed easily or they're kind of red and inflamed, that can be not enough A, along with some B vitamins, which we'll get to in a moment. So the next area is essential fatty acids. So essential fatty acids are very, very important for so many parts of our body. And you've heard of the omega-3s and the omega-6s, and the omega-3s are found in fish oil, so we've kind of heard that lingo. But what is it that these essential fatty acids do for us? They're called essential because we can't manufacture them. We actually need to ingest them. They're very important for just keeping the cell membranes, so you have 10 trillion cells, and just keeping the membranes healthy. They're very important for the nervous system and the brain. They keep clots from forming, so you're not going to get a heart attack or stroke. What all do? They can block tumor formation in animals. They help with your thyroid and adrenal glands. They're a natural anti-inflammatory, so that's kind of the big overriding benefit of essential fatty acids, is that they're anti-inflammatory. And as we know, inflammation is moving us toward degenerative disease, and if you have enough anti-inflammatories, you tend to pull back or move away from degenerative disease, which of course is something that we all want to do. And the essential fatty acids are found in the fish oil, as we mentioned, precursors to the actual omega-3 EPA, which is what's in fish oil. The precursors to that kind of going up the chain biochemically you can get in chia seeds and flax seeds, walnuts. So these are all things that can kind of trickle down and help us make more omega-3 fatty acids. They also are found in fish themselves. You don't have to buy the fish oil as long as you're getting a good clean source of fish and not something high in mercury. sadly. And also our eggs are omega-3 enriched, so you can buy some eggs in the grocery store that say that the feed to the chicken was omega-3 enriched, and then the egg comes out with higher omega-3. So there's your source there. Acne is associated with not enough essential fatty acids, as well as our favorite dermatitis, that dry, scaly skin, the chicken skin, as we've mentioned a couple of times now, eczema itself, dandruff, flaky dry hair, and also they call it nasolabial seborrhea. So that's right where the nose meets the face in that fold, and you get that reddened area that you see. It can be a little bit dry or reddened, and that's seborrhea. Also, if at the tips of your fingertips it's kind of cracking, that's also associated with not enough essential fatty acids, along with weak fingernails. So there's a lot of skin issues associated with essential fatty acids, but realize if you're seeing it in your skin, it's also really affecting you deep within your body in ways, not good ways. So there's a blood test that we offer here at the clinic that can look to see how your essential fatty acids are doing. Certainly you can make dietary changes if you look at your diet and realize, you know, I'm really not getting enough of these types of foods, or I'm getting too high in the omega-6s, which are like the seed oils and the saturated fats and the prepackaged types of foods that have sunflower seed oil and safflower seed oil or corn oil. All those types of oils that are not as good for you tend to push the omega-6s, and those are inflammatory versus the omega-3s, which are anti-inflammatory. So I want to finish up with the B vitamins. The B vitamins are very, very commonly associated with skin conditions. So remember that cracking at the mouth, at the corners of the mouth, that's associated with B vitamin deficiency. The geographic tongue that we mentioned earlier is as well. Anything to do with the gums and periodontal problems associated with Bs. The gingivitis, as I mentioned earlier, that redness and you bleed easily if you're, when you're flossing your teeth. Glossitis, which is just a red inflamed tongue. Your tongue feels uncomfortable in your mouth. It's red and inflamed. And then also fissuring along the midsection of the tongue is also a B vitamin deficiency. So, as is bad breath. It's called halitosis. That's associated with the Bs as well. So these are all associated with Bs. Now, where do we get Bs? In a lot of different foods like whole grains and lentils, dark green leafies, almonds and pecans, and animal products as well, like meat and fish and eggs and dairy products. So you know, I'm not a big dairy fan, as you know, but it is found in there. So then you might look at your particular diet and say, I don't know, I feel like I'm eating these foods, yet my skin is still, you know, not looking the way I want it to look. That's very important, because what is probably getting in the way is either a food sensitivity, like gluten or dairy, or you're just having some absorption problem. So that good oil or good Bs or good zinc, it's going in your mouth, but then it's not getting to your cells and it's not being reflected in the health of your skin. So then you really want to find out, where is that malabsorption coming from and why. And food sensitivities are a very common one. Leaky gut is a very common one. You don't have enough enzymes to digest your food and therefore absorb it. So there's a few things that can get in the way, and you've heard me probably talk about leaky gut in the past. But that's when you want to find a doctor that does root cause medicine, a doctor that does functional medicine, to really help transition that good stuff that you're putting in your body into healthy skin and nails, because it truly does reflect what's happening inside. So don't let anybody tell you, oh, your skin is just naturally dry. It's not normal. It's like telling somebody that going to the bathroom once a week is normal. It's not normal. It might be common. It might be something you've experienced for a while, but that doesn't make it normal. It doesn't make it healthy. So look and see what you see. Let me know. Give me some feedback. Ask questions. I always do love to hear from you. And until next time, I wish you very good health.